putting a mask on yourself is more to prevent you from infecting someone else. And if everybody does that, we're each protecting each other, because the data is it's more efficient to prevent transmitting to others than it is to prevent transmission to yourself.
All right, that was Dr. Anthony Fauci on the CDC's recommendation that Americans wear face masks in public. Joining us now to discuss that and more, Dr. Vin Gupta, a pulmonologist who has treated critically ill coronavirus patients in Washington state. He's also an NBC News medical contributor. And Ed Yong, a staff writer at The Atlantic magazine covering science, whose latest piece is on the masks question.
Doctor, let's begin with you. How important is the CDC recommendation that people start wearing masks to prevent others from picking up any germs they may be transmitting?
Thanks, Joe. I think that we have to respect and honor the institution that is the CDC. They're our highest public health leaders, and they're operating, frankly, as Ed has already pointed out in his piece in The Atlantic, in a space that's unknown. There's a lot of uncertainty. So to issue a guideline, a recommendation that we should perhaps all be wearing fabric, homemade face masks when going to a department store or grocery store is their best guess at looking at the science and saying this is what we should do. So we should honor and respect it, and we should have a president who doesn't immediately try to enfeeble it the second that he issues the guideline. So I think that's the key piece here. Let's all respect what the CDC says and try to honor it, recognizing there's a lot of uncertainty.
And so, Ed, there is a lot of uncertainty, but I'm so glad you write and you talk about what you've talked about as far as what is still safe. You say, for the most part, being outside still is safe, that ventilation is so important. Also, spacing is so important. If you're going outside, if you're being active in places where you can maintain a safe space, that's still okay, right?
Absolutely. Distance and density are both really important here in outdoor spaces, especially those which don't have large crowds of people. It should be fine to be outside. One of the experts I spoke to in my piece said that when she's outside, she imagines that other people around her are smoking, and she takes steps to avoid being in those hypothetical clouds of smoke. And I think that's a really sensible framework for thinking about all these different hypotheticals that we could really tie ourselves in knots about.